Hypnosis is a process that involves the deep body and mind relaxation. Before we get to the various hypnosis stages, it is important to first understand how hypnosis works or the process of hypnotherapy. 1. Getting ready. Every hypnotherapy session with a qualified therapist must be carried out in a relaxed, safe, and calm environment where there are no interruptions of any kind. There is usually a preliminary discussion between the therapist and the person to be hypnotized. This is usually done to establish if the person has had prior hypnotism sessions and their experiences, as well as trying to establish the problem one needs working on. Most of the problems usually include a behavior or thoughts a person needs to balance or completely changed. For instance, a person may be struggling with bedwetting. This behavior, with the help of hypnosis, is addressed and changed. A skilled therapist should gather as much information as possible during the preliminary talk. This is important so that he may work on the best technique for the particular person and problem. The pattern most therapists use during the session is loose. It follows preparing and screening a client, inducting a client to an altered state consciousness state, deepening the trance state that opens suggestibility, post-hypnotic suggestions. This is where advice is given regarding the problem the therapist worked on. 2. Induction. In a typical hypnotherapy session, the initial 15 minutes are for helping the client relax their mind and body. This stage is referred to as the induction stage. It involves helping a person to enter into a light state of trance by the use of relaxation techniques that work on the mind and body. Gradually, the person is encouraged to relax their muscles and mind. This technique is aimed at ridding a person of any tension and releasing anxiety. The therapist focuses on instructing the client to slow and control their breathing. This is also to help relax and distract the conscious mind so that a person focuses on the subconscious mind. Because of many methods of induction, it is important for the therapist to understand their client and apply a method that works for them. 3. Deepening a trance. This stage is where the subconscious mind is made ready to be more receptive to suggestions or new behavior. Once the mind accepts new thought patterns, a change in behavior follows. To deepen the trance, some therapists may opt to continue reinforcing the induction method used. The method can be accompanied by visualization techniques that are very deep to increase the trance. A qualified therapist knows that it is important for a person to be deeply altered in consciousness before starting hypnotic suggestions.